Hello and welcome to the Dr. UT lectures. Assalamu alaikum. Today's discussion is about Parkinson's disease. What we will discuss about Parkinson's disease first, let me tell you guys about those points that are going to be discussed in today's discussion with you guys. First of all, we will talk about what is Parkinson's disease or how to define Parkinson's disease. Then we'll talk about the signs and symptoms of the Parkinson's disease. Then we'll talk about the causes of the Parkinson's disease. And further, we will elaborate what is actually happening in the Parkinson's disease. You can say it is a short form of the pathophysiology. So then we will talk about the treatment options, how this Parkinson's disease is actually maintained. So education purpose video, just concentrate. Disclaimer, okay? We have to put a disclaimer whenever you are making videos, such kind of videos in which we talk about this portion. Well, so first of all, we will we'll take the start from definition. Yeah. Define, how to define or the Parkinson's disease, or what is the definition of Parkinson's disease? It is simply the progressive neurological disorder, progressive type of neurological disorder. What kind of neurons? Neurons that are responsible to provide dopamine in the body, okay, mainly in the brain. So neuronal damage is actually seen in the Parkinson's disease. Those neurons which are producing dopamine. So this is actually a kind of progressive disorder. So with the passage of time, this disease worsens, okay, or aggravates, or becomes to a rough type of stage, which is actually making a person much unhealthy. Anyways, so coming to the next point, that is the sign and symptoms. Very simple. Difficulty with movement. The very beginning, the very common type. Okay, sign and symptoms include difficulty with movement. A person is not able to initiate, means to start the movement, to continue the movement, to maintain the movement. So simple. Difficulty with the movement is actually seen thereby. So along with there is muscle movement is actually disturbed. Rigidity is seen. Tremors is seen, and abnormal gait or posture. So a person cannot maintain the proper gait, the proper posture. So this is all about the movement disorder. That is Parkinson's disease. So Parkinson's disease is concerned with movement disorder. Which one? Controlled movement disorder. Before now we have a control mechanism. Okay, we can walk, we can move, we can uh, reach something, we can grasp something. So all these are actually controlled and controlled movements. We can say autonomic, not autonomic. The same point is there. Well, so voluntary controls. Okay, voluntary actions, voluntary movements. So voluntary movements, voluntary actions are actually controlled by us. So those voluntary controls then kind become disturbed when a person is attacked by the Parkinson's disease. Means when a person is affected by the Parkinson's disease, or when a person gets Parkinson's disease. You can say anyway, whatever the way you understand, just focus that. Anyway, so what we talked about the what is the Parkinson's disease. It is neurological disorder, okay, progressive type of. Which one? Those producing dopamine. And in the sign and symptoms, we talked about the movement problems. So mainly we see movement problems. A person cannot initiate, cannot maintain proper movement. So then comes the point, that is the causes. What are the causes of the new Parkinson's disease? Very simple. There is unknown, okay, some unknown causes are also thereby. And what known are actually genetic may be the cause. So genetically it can be observed. And toxic components, when we just use or consume toxic compounds, just like opioids, they can cause us Parkinson's disease. And some pesticides exposure, when we expose our body to the pesticides, we can also have Parkinson's disease. So chances are there. So these are the causes, of which Parkinson's disease can be observed. Then we talk about the elaborations. So now how to elaborate this pathophysiology, what actually is the mechanism seen inside the brain. Normally, there are three portions of the brain: forebrain, midbrain, and hindbrain. So in the midbrain, there is actually a black spot. Black spot. That black spot is known as substantia nigra. It is actually one of the basal ganglion. Okay, so if you know about the basal ganglia, it's okay. If not, then you have to visit our other lectures to know about the basal ganglia. Anyway, so in the midbrain we have a black spot known as substantia nigra. This portion is actually the responsible for the Parkinson's disease. Why? Because this starts disappearing, and this is further composed of two parts. Substantia nigra is composed of two parts. Number one, pars reticulata. Number two, pars compacta. Now, this pars compacta, the second one, this is responsible for the dopamine synthesis, dopamine production. What happens? This pars compacta in the Parkinson's disease is not responsible, is not able. It is responsible. It is not able. Yeah. So it is not able to produce dopamine. So when dopamine is not available, then what will happen? Simple. Now what is happening? First of all, when dopamine is available, compactor will produce dopamine. That dopamine will then regulate the basal ganglion circuitry. So what is now happening here? By this substantia nigra, along with some other basal ganglia like caudate, putamen, pallidus, okay, all those. So all those are actually a kind maintained. So their circuitry are kind maintained. Okay, so there's a kind of interaction between all these. Okay, among all these basal ganglia. So when this portion of the basal of the substantia nigra, that is compacta, the portion of the substantia nigra known as compacta. When this compacta starts kind of inhibiting, means when it starts inhibiting the production of the dopamine, so dopamine is now not available. When dopamine is not available, what happens then? Then that connection among the basal ganglia is disturbed. So what that ganglia was actually, though that connection was doing, that connection was responsible to provide the voluntary controls to the best of it. Like we will be able to maintain our movement, we will reach the objects in a very good way, and we will grasp, and some other voluntary controls can be performed in a very well fashion. So now what happens is actually this substantia nigra, the portion of this substantia nigra compacta is actually disturbed, and it is not producing dopamine. So when this dopamine is not available, then the connection among the basal ganglia, caudate, putamen, globus, pallidus, and substantia nigra, that is actually then disturbed. When that is disturbed, then the movement is actually disturbed. Which one? Voluntary controls are actually disturbed. Then we cannot move, we cannot initiate the movement, we cannot reach the object, we cannot grasp the object. So all these problems are actually seen, and when these are actually seen, then we say that the patient is having the problem, that is the Parkinson's disease. Got? So now what happened? The entire discussion, we talked about dopamine, 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 dopamine. So it is all about dopamine. Now what we are having is, in treatment options, we will just concentrate on dopamine. We will concentrate on the produced dopamine in the body. If the body is producing dopamine, we must protect that dopamine from the enzymes known as MAO, monoamine oxidase, and COMT, catechol O methyl transferase. So now these enzymes, when they are inhibited, then what will happen? Then the natural in the body, which the dopamine that is produced in the body, that dopamine will not be then destroyed anymore. Why? Because these enzymes are responsible to destroy that dopamine. So we will inhibit these two enzymes in order to protect the dopamine from destruction. Then we have certain other medication which are actually responsible to provide us the dopamine from the external source. One is production inside the body. So inside which is produced, we will protect them from destruction of that is from the attack of these enzymes. So we will give medication MAO inhibitors, COMT inhibitors, and then we will give levodopa. Levodopa will be converted into dopa, which is actually dopamine. When that dopamine will do the job. Okay, so we need dopamine. This is how we are actually maintaining dopamine level in the body. Another important point: there is another chemical neurotransmitter having interaction with this dopamine, that is actually acetylcholine. So these both, their level should be maintained. If one is increasing, another is decreasing, there will be problem. That is Parkinson's disease. So we have to do the check of the acetylcholine and dopamine. We have to maintain both the levels. So for that, now dopamine is not available, so we will have to decrease or inhibit the production or the concentration of the acetylcholine by means of certain medication like benzhexol, benztropine, piperidine, etc. These are actually anticholinergic drugs. So what we are actually doing is we are actually maintaining the level of the dopamine and acetylcholine. We must keep both in level. Neither should increase nor other one should decrease. So neither should increase or decrease. Okay. So we are actually talking about the level hereby, and hereby we are talking about the medication, that is dopamine, which is actually given from outside, synthetically prepared one. And here we talked about the medication like MAO and COMT inhibitors, which are actually working on the enzymes which are responsible for the breakdown of the dopamine. So that's it all. I hope you got. If you still have confusion or question, drop in the comment box, and don't forget telling your friends about Dr. UUT lectures.